So welcome everybody to our normal COVID Community Champions meeting. As usual, the meeting is being recorded, so those who can't make it can listen back, watch back afterwards. If you want to ask a question and you're a bit shy, please do it in the chat, or you can always email us. And the agenda is, we've got a data update, and it's from Steve Turnbull, who's covering for Anna today because Anna's off. I did advertise, and it was arranged that we would have a trial update about Provent from Helen Brailsford, but sadly yesterday she's had to postpone it, so that's going to be at a future meeting. So apologies if you've joined to listen specifically to that, but she will come at a later date. Darsha Farmer's joined us for a vaccine update, and then either myself or my colleague Andrew will speak a little bit about the COVID Stakeholder Influencer Kit that was emailed to you all recently. There's an opportunity for some flu and COVID vaccination hesitancy training, which I know that at least one champion has booked already, but just a reminder about that. I probably won't be able to play the Let's Keep Moving video, but I can give you the link. And then, as you probably already are aware, next week will be a special GP meeting to raise concerns and issues that COVID champions have already expressed about accessing GPs and primary care. So first of all, welcome Steve Turnbull, who's going to give us our usual data update. Over to you, Steve.
Yeah, so just a couple of slides. You probably get these quite regularly, but I'll just talk through some of the latest changes. So this is the very familiar chart looking at our 7-day case rate and over the previous week, and right at the right-hand side is the most recent figure. So what you'll see is we came down off that really big peak in the Delta wave, and then we've come down really well, and then we hit that plateau, which is a lot of areas have had the same kind of pattern, and then you'll see it suddenly peak upwards and then come back down again. So what happened in that peak? That's partly for two reasons, really. One, it's the festival season, so lots of people went and got tested, which finds more cases before they went into festivals, and there may be some cases, some people who may have been out and about more, including at festivals, which drove the case rate up a little bit. And it's come down off that peak as we've started to settle back down. So it's a bit of a spike, but the general picture is we are slowly, largely level. We're not really going up, we're not really going down, and that's a similar picture across most of West Yorkshire. I always find this a really tricky slide to get my head around. There's three charts. If I go left to right, the chart on the left is showing Wakefield, West Yorkshire, and England. And I think I might be almost a little bit colourblind because the Wakefield line, which is the kind of lighter blue, and the England line are very similar to me in terms of colours. But the Wakefield line is the one that's closest to the West Yorkshire line, with again very, very similar pattern. And what this shows is the number of people that test positive as a proportion of the people that get tested. So if 100 people get a PCR test, then we're currently seeing around 10 of those 100, 10% are coming back positive. Similar picture to West Yorkshire, and again that reflects the kind of high level of COVID we've got in circulation. The middle of the three charts shows the number of people who have been tested. So are people still coming forward for testing? And you can see that has changed for West Yorkshire, Wakefield, and the England average as a whole. Ignore the little bits on the right hand side. Now it shows it falling off a cliff, because that's incomplete data. So it's probably not as dramatic as that. It will have come down a little bit, but it won't have come down as much as that. And then on the right hand side, this is the positivity by age group just for Wakefield. So this is showing what percentage of people are testing positive by different age groups. And it's a really messy chart. So I'll just pick out a couple of things. First of all, there is a kind of a bright orange line that kind of comes down a little bit. That's the 17 and 18-year-old age group. And again, that probably went up because testing before you go to some of the big festivals, and then that slightly started to come down. Similar pattern in the 19 to 24-year-olds, that's coming down really well. And then you've got some of the other groups going up. So you've got an 11 to 16 rise, which has been partly because of going back to school and everybody being tested before they go back to school, but it has stayed high because we're starting to see cases in school-age children now that they're back at school. And remember, school-age children are not vaccinated by and large, and there's fewer mitigations in school to stop spread. So it's inevitable that we'll see more cases in those age ranges. And the other thing just to notice about this chart is it generally follows the pattern of vaccination. So the lowest positivity rate is in the 80+ age range, which has got the highest coverage of vaccination. So it just demonstrates that vaccination is still very protective. And again, this is just testing rates, and it just shows that the two big bumps we've got here are the 17 to 18-year-olds who going out and about to festivals, and that requires that gives a bump of testing, and then it stayed higher because again, people going back to college and universities, then that keeps that a little higher. And then you've got this obviously rapid rise in school age. People who had to test before going back into school are now encouraged to test regularly during the school time. So ideally test twice a week on LFT tests. So that explains that chart. And if we move on to the next chart, this is the age. This is a breakdown of ages and overall case rates by ages. So at the very top, you've got all ages. So you can see there, that is the district, Wakefield district average. Anything to the right of the dotted red line is incomplete data, so will change. And it only ever goes up. It never comes down, but it does give a little bit of a picture as to where we might be heading. And you can see the darker colours have started to fade a little bit as we've come down and plateaued as I described. We're currently just around 300, just a bit over 300. And then you can see the similar kind of pattern in different age ranges. And you'll see the darker colours are the ones where we've got the most infections. And you'll see there that it is currently the highest number of infections is in the 11 to 16-year-old age range. And as I mentioned, that's because these are largely unvaccinated and are going back into school settings with very few mitigations. So, no bubbles, no face coverings, no isolation if you're a contact. So we're going to continue to see this pattern for a while, I suspect. The other thing just to note is we've got some reductions in the 19 to 59, but a slightly concerning picture is our 60 to 79-year-old age group. They have started to come down, which is positive, but actually it's still around 200 cases per 100,000. So that's a relatively high level. And if you ask yourself why that might be, there's possibly two reasons. One, people in this age range are probably now getting a bit more confident and socializing a bit more. Good vaccine coverage, but one of the flip sides of the vaccine coverage is that you may be more confident to go out and about, and the vaccine can suppress COVID symptoms. So if you're in this kind of 60 to 79 year age group, you may get what you think is just a little cold. Don't think it's COVID, carry on socializing, and then spread it amongst your friends. And so we've got to be very mindful of this age group because they are still more vulnerable to having a poor outcome from COVID and needing hospital admission. So there is just a little bit of caution around this age group here. But generally, we can see the 80+ has started to improve, and the 60 to 79 starting to improve, but very, very marginally. So we just need to be careful of this. Particularly, one thing we probably need to just watch out for is these school-age kids where there's lots of infections. we need to just be cautious around maybe grandparents looking after them and picking them up from school, and we may just want to keep an eye on that just in case there's then transmission in kind of broader family circles from younger people into older age ranges. So we just need to be careful on that point. Then we've got the picture across the district by geography. This changes very rapidly. If we looked at this picture today, it would probably look a little bit different. So don't be too alarmed that if you live in an area where there's higher rates currently, it's fair to say that across the district, it's a very similar picture. Some places a little bit better than others, but give it a week or two and they may all swap around. So it's a very fluid situation. But it is nowhere in effect is being spared from this. And then if you go on to the next slide, which is admissions into Mid Yorkshire, into Pinderfields. So this is divided into the blue bars, which are Wakefield residents, the red bars are non-Wakefield residents, because obviously Mid Yorkshire serves Wakefield, but it also serves North Kirklees as well. And you can see that the two things really to note. One is the peak that we've got here and coming back down a little bit just mirrors the infection rate generally that we've experienced, but it's not anywhere near the size of the previous peaks that that you can see further back on the chart. And that in effect is the vaccine effect. It is helping people, even if they do get COVID, then their symptoms are likely to be milder, not always, but milder, and needing less chance of being admitted into Mid Yorkshire. And if you move to the next slide, which is our COVID deaths, again, we are still having numbers of deaths. So 11 in the last week, which is sad, but you can see that is thankfully nowhere near the levels we've had in previous waves. So it gives us that mixed picture that the vaccine is very good at stopping people dying. It is very good at stopping people being admitted. It is less good at stopping people transmitting the infection and being infected themselves. So it's protective, but it doesn't stop COVID circulating entirely. It just helps. And the last slide from me before I open up for any questions is just update on vaccination status. And you will see that it is, generally speaking, I mean, overall for Wakefield, we can't argue. We've done a very good job. We've got 79% of the population completely vaccinated who are eligible for the vaccine, and but some of that progression has started to slow down a little. And there's a couple of points here as we move to the next stage of the vaccination program. The two things that are going to be rolled out next will be the 12 to 15-year-old vaccination program and the third phase, the booster program. And the important thing for these is that the biggest benefit you get from the vaccination program is the first jab. So whilst we've got very good coverage on all of these top cohorts that you can see, care home residents and 80-year-olds and the more elderly, very good coverage into 90%. That still means there are some people there that haven't had the vaccine, and the biggest impact you can have is the first vaccine. So getting your first vaccine is more important than getting your booster. But the booster program will also roll out to try and prevent any of the waning effect that might be present in some of the vaccines. I'll pause there, Tracy, and happy to answer any question on that or any other kind of general COVID questions.
Thank you very much, Steve. Has anybody got any questions they'd like to ask? I've got one actually, Steve. In the early days, we were talking about herd immunity and that we needed to have a certain percentage of people vaccinated to secure herd immunity. Is that still the case?
Okay, herd immunity is a really interesting concept. So, the way that you have to think about it is that right at the start, go back right to the start when COVID first became known as a disease, everybody on the planet was susceptible because anybody could catch it. Nobody had immunity from it. And you get immunity from an infection from two sources generally. One, being infected and your body learns how to respond to that. So that's naturally acquired immunity, or immunity through vaccination. And if you have immunity, then you no longer are in that susceptible population, which means the virus finds it harder to go from person to person because it can't transmit as readily. It doesn't find a new person to infect. So the concept of herd immunity is if you get so many people in the population that have immunity, then the outbreak dies down and disappears simply because it can't spread from person to person. It can't find another person to infect. How many people you need to get into that group of people who've got immunity depends on a number of different things. It depends largely on how good the virus is at spreading. And the first COVID virus that we dealt with added on our number. You remember our numbers? That added our number of probably around 3, and that means that right at the start, the first anybody who was infected would probably pass it on to 3 people. Then we had Alpha, which was more transmissible. Now we've got Delta, which is the dominant variant. And estimates now for Delta would be an R value probably in excess of around 5 or 6, which means you need even more people to be immune to break those chains of transmission. So, and really, the other part of the jigsaw is how much protection does the vaccine give you? If it works for everybody, that's brilliant. But we know some people don't respond well to the vaccine. This is the same for every vaccine. Some vaccines are really, really good and everybody responds to them well, others less so. But so that's the idea that if everybody gets vaccinated, then you're protecting the people who don't have a good response to it. And what we've got is vaccines are very good. They don't protect everybody entirely, as I've demonstrated. But to reach herd immunity for something like Delta, you'd have to get very high levels of the population who are immune. And you can see that the vaccine program is having an effect, but I don't think we'll naturally get to that level of immunity through the vaccination program and natural infections, simply because we're not vaccinating the entire population. We started to roll out in 12 to 15-year-olds, but there are under 12s as well. So and the under 12s are constantly appearing. Every time we get a birth, we get a new under 12, which is why in the very long run, in maybe a decade or so, we may find that COVID is something that you catch as a childhood illness because you're susceptible to it, and other people will be protected by the vaccine program. So it's that's a long-winded answer, but herd immunity is not something I don't think we can rely on as a strategy. So I don't think we'd really get there, but it is. But that's not to say that vaccine program isn't worth it, because we can slow down the spread and manage it in ways that we manage other kind of infectious diseases. For example, measles. We manage measles by vaccine program, but also by responding to outbreaks. We still do get outbreaks of measles, and we respond to that and prevent some spread there. And measles is hugely transmissible, far more than COVID is. Hopefully that helps, Tracy.
Thank you very much. Yeah, that was a really comprehensive answer. Thank you. Does anybody else have any questions to ask for Steve while we've got him with us?
I can see a question from John. How many of those admitted to hospital are not vaccinated? I don't have the answer to that on our individual Wakefield district cases, but we do know that if you look at, this is one of those, it's like a trick question, because there are far more people vaccinated than not vaccinated. So it may look like there are more people in hospital who are vaccinated, but that's because they outnumber the unvaccinated group. But if you look at the rates of people in hospital, then the rates of people in hospital from COVID who are not vaccinated is far greater than the rates of people in hospital who are vaccinated. So vaccination will protect you from Not in every case, but it is very protective against hospital admission.
Thank you very much. I've just seen in the chat that somebody couldn't hear me very well, so I'll try and speak up. Thank you very much, Steve. And we've now got Darsha Farmer to give us an update on the vaccines.
Thank you, Tracy. And as Steve already mentioned, one of the rollouts that we are doing now is 12 to 15-year-olds. So just to point you to a leaflet that has been produced for this age category, because in the past, in previous slides, we shared one for 16 pluses. This leaflet with the link that you may find useful is specific guide for children and young people around the vaccination. Just to do a reminder in terms of the dose that they will be given, it will be Pfizer that will be administered, and it will be via invitation, and a parental consent will be sought. There is a little bit of a difference in terms of 12 to 15-year-olds at a greater risk of serious COVID, and if they are household contacts of those who are severely immunosuppressed, that group of 12 to 15-year-olds will receive 2 doses. And also, should you come across a family or a young person who falls into that category, they won't be included in the school program, and they will be contacted or are being contacted separately via the NHS. So just to do that little note should you get any queries. And those who have a specific immunosuppressive condition that falls within the JCV guidance should have 3 doses in their primary schedule. And again, that will be separately looked at, and that will be arranged by a consultant or a GP, so the family and young person would be contacted. On the next slide, we've got a little bit of information about boosters. So I did mention at the last meeting that we are looking at boosters, and based on the JCVR recommendations, so it's all the categories that we were looking at the beginning of the vaccination program. This is a list of those who are eligible for boosters. It is saying in terms of the ages being 50 plus and 16 to 49-year-old with underlying health conditions. We are looking at the timescales being similar to the first rollout of the vaccination program. So we'll be looking at frontline health and care employees, looking at residential care homes, and those who are 80 plus and housebound patients. We are looking at that is being planned, and we are looking at dates later this week, next week, for that to be implemented. In terms of boosters, generally speaking, one of our biggest sites, Navigation Walk, is looking at boosters and appointments from next week, and community pharmacies, so that is Boots, and the pharmacy to you sites are also looking at in a few days' time starting to be able to offer appointments. A little reminder that those who are eligible will be contacted or will receive a text message from the National Booking Service, and it will be when you are at least 6 months since the second dose. I've heard from some patients who have received the messages already, so they know that they are eligible, but they can't quite book at this very stage because they are potentially not quite the 6 months and able to make that appointment. And we would really encourage people to keep up both vaccines in terms of COVID as well as flu. So if you do have an invitation to either of them, please don't delay appointment, please attend whichever one comes first, especially as we are trying to work through whether we can co-administer the vaccines at the same time. Third dose for those who are severely immunosuppressed is different to booster. So anyone who is eligible and has been identified by the NHS will be contacted to get a third dose. And really, it's just a reminder and links to what Steve was saying around the vaccination and the importance of the first round of vaccination. And the really great benefit that we get is that everyone is eligible. Just because we started booster program, we are still ongoing with the vaccination program. So for anyone who hasn't had their first or second dose, they are eligible, they can still attend for their appointment. Is just a little bit of a resource link. So there have been several videos that have been done by NHS colleagues at Northwest, and they are translated into various languages. So we wanted to share them just in case you find links to the videos useful. If you want to share them, please share across your channels as you find appropriate. More information that we can share for as many people is best. So please feel free to use those.
I'll come off mute. Thank you very much, Darsha, for that update. Does anybody have any questions for Darsha before we move on?
Just a quick comment, Tracy, if I can. Something I heard this morning that I think I didn't know and is quite useful to share. And that's regarding staff in care homes. People have heard that there's a mandatory requirement for them to have had both vaccinations by the 11th of November. Apparently, there's no mandatory requirement for them to have the booster. So I just heard that this morning, thought that was worth sharing. So it is just the 2 vaccines that's mandatory. There's no mandatory thing for the booster.
That's interesting. Thank you very much for that. I didn't know that either. Thank you very much. So the next slide then, Andrew, I'm not sure if you'd like to speak to this or shall I?
Yeah, this is just quickly, this is a new stakeholder and influencer toolkit that has come down from government, which I believe was shared at the end of last week to the group, and hope people will agree that it's a very useful kit, very useful document with easy links to sort of assets and messages. Tracy was unaware of this, and I must say I was as well till last week. So what I will do is do some digging, because I think it will be useful to share a link as to where it resides, where it's hosted on the internet, so people can look at previous versions, look at future versions, and there might even be an opportunity to ask to be emailed it when it comes out. But I'll do some research on that and share any links that I find.
That's fantastic. Thank you, Andrew. And yes, it was emailed to everybody. It was, I think it was the weekly roundup, when we give you all the news in a big list, and it was an attachment to there. So please do take a look at it if you've time, because it's a really good resource. Important it is to get vaccinated. There is some new vaccine hesitancy training, and it also includes flu as well. This has been emailed to you, but I know sometimes I send so much that it's easy to skip something. So Public Health England have commissioned some workshops, and there is a link, and I will send the link out with the after email if you'd like to take part in the workshops. I think they're quite conversational styles. It's not like an exam afterwards, like being at school, just giving you lots of opportunities to chat and discuss and find out more information. Our comms team have made an excellent Let's Keep Life Moving video, which I think our own Andrew stars in. Is that right, Andrew?
It is, yeah.
And I know that our COVID champions have been given opportunities to be in any videos, and that invitation still stands. If you're interested, please do. Sadly, I can't show the video, but there's the link. You can watch it at your leisure, and look out for Andrew. And a reminder that the next week's meeting will be around GPs. So if any people that you've been speaking to are saying that they're concerned they can't access a GP, or they've been ringing and ringing, they want to come and listen, do invite them as well. You're welcome, and anybody that you think might find the meeting useful will be most welcome to come. So unless we've got any other questions or comments.
I've got a couple of quick things, Tracy, if I can.
And I think, Pam, are you waving a flyaway, or would you like to say something as well? Oh, she's just waving. Okay, Andrew, yeah.
The first one, people who were on the call last week may remember that we announced that we were really pleased to have reached the final of some awards for the Let's Keep Life Moving campaign. We just heard this morning, literally just before the meeting, that we've actually been shortlisted in another set of awards for the same campaign. So it's the Let's Keep Life Moving campaign, and this time it's the PRCA, which stands for the Public Relations and Communications Association. Public Relations and Communications Association, PRCA, and it's their Health and Wellbeing Award. So we're amongst the finalists, and the final award is announced in London on the 9th of November. So I think that's about, well, exactly 2 weeks before the other one we mentioned last week. So obviously really, really pleased with that. And as I say, it was literally about 5 minutes before the meeting started. So it's hot off the press, that one. And then just very quickly also for me, I just wanted to introduce my colleague, George Butler, who has joined us on the call today. George joined the comms team on Monday to assist in the COVID team. And just linked in with that, I will also just say that for those who don't know, this is actually my last meeting, my last COVID Community Champions meeting. I am moving on to do other things, but hopefully we'll still be in touch because part of what I'm doing is going to be working for the regional programme, the regional vaccination programme. So I'm sure our paths will cross. So working for them and exploring some other opportunities as well. But it's been great working with you all, and certainly hope we can paths will cross again in the future. And welcome to George. I don't know if you just want to introduce yourself, George.
Yeah, hello everybody. I joined the comms team on Monday, so I'm just finding my feet at the moment. So just getting up to speed. I'm enjoying my time so far. It's a good team to be working with, so it's all good so far.
Fantastic. Thank you very much. Well done to the whole of the team for those awards. I hope that you do well, and good luck in your new venture, Andrew. Thank you very much for all the support that you've given to us. Thank you everybody for joining. Please do share information that you've received. I will email afterwards with all the links and things. Thank you very much, and we'll hope to see you all next week.